at the essence of what's actually going on there? Because,
Yeah.
addiction is downstream from something else. Well,
Yeah.
what is actually going on?
Yeah, so that's a really great question. Like, what drives people to use substances? It's actually probably the most important question, even in my work. If you don't understand what someone's substance use is about or related to, how are you ever going to address it or help them address it? So, trauma is probably the single biggest driver. So, you often hear things like cannabis is a gateway drug. I would say trauma is the gateway drug. If we look at many, many studies, they're kind of two different things that drive someone's risk of addiction. One is genetics. It's about 40 to 60% genetics, similar to diabetes in terms of someone's risk. That's not a done deal, obviously. There are people with strong genetic risks who never develop addiction and people without that who do. The other half of the equation is based on kind of your exposures and your experiences. And one of the number one drivers is what we call adverse childhood experiences. So there's this famous study called the ACEs study, which stands for Adverse Childhood Experience, and it's been replicated. There's a recent one done actually in Europe as well that looks at the number of adverse childhood experiences you have, and it's a linear track increase in terms of your risk of substance use disorder. So if you think about what's happening in the brain with substances, when we use alcohol or drugs, all sorts of feel-good hormones are released, right? Dopamine, your endogenous opioid system, which is literally your natural pain reliever. And if you take someone who's experienced trauma, there's great relief that people can find in substance use. And so we saw that in the pandemic. Like, what was going on in the pandemic? People were scared, they were bored, they were lonely, they were stuck at home, they didn't have their usual routine. Some people were losing people that they loved. And so we saw all of this escalating substance use. And it was actually most pronounced in people who are frontline workers. So that could be a healthcare provider. It could also be someone working in a grocery store or a convenience store who had to work through the scariest times of the pandemic, and also people who are caregivers. So those are kind of the two groups that had the biggest increase in their substance use during the pandemic.